the greatest resources here at Duke are our students. And unquestionably, we have seen an extraordinary surge on campus. That's been very gratifying to people like myself to see that there are so many students interested in our area of work. And so we actually have a number of new, of course, curricular offerings that we hope that will grow as well over the years. This past year, we introduced a new course called Designing Innovation for Global Health. It succeeded a traditional offering we had done for the past 4 years every spring semester, which had been on globalization and health equity. But this new offering has certainly, I think, potential to grow as a program that we hope will also offer some new opportunities for students. It focuses at really the enabling environment for innovation and access for appropriate technologies in developing country settings. And as such, has drawn students as far flung as the engineering school to graduate students in the public policy school. And this past year was just a starting point, but we look forward to evolving this program further in a way that we hope will bring an opportunity for our students to also not just know how to engineer the technologies, but to think deeply about how are they funded, what type of capacity building actually results from actually the type of efforts we do in partnership with those in developing countries, and importantly thinking about new models of innovation, such as end-user inputs to innovation, open source science, and new ways of which ownership is shared of the knowledge in a way that hopefully enhances their ability in the places that we hope to benefit to actually contribute as well to the same process of innovation that for their endemic diseases. We have a Global Health Fellows program also over the summer, which is now finishing its 5th year, and we hope to continue renew it again in the coming year. We've benefited immensely from the support of the Duke Global Health Institute for the program. It's not an inexpensive undertaking, obviously. In fact, both the Duke Global Health Institute, the Sanford School, and our program cross-subsidize parts of the program at this point in time. It provides the remarkable rewards we hope for the students involved, because what we're trying to do is give them a taste of what it is like to be in a policy environment in Geneva, which is the hub of global health, of course, international policymaking. And the students come for a minimum of 8 weeks, where they are placed into various internship sites, either WHO, UNAIDS, a number of intergovernmental agencies, or NGOs throughout the city. They spend the time there. And in addition, they have a 1-week intensive course that's co-organized with the WHO. And in so doing, they have an opportunity in the morning sessions, jointly with actually junior staff from WHO, Global Fund, and UNAIDS, to hear a range of experts. We will go to the World Trade Organization, spend a morning there, hearing the people who, in fact, work on these policy issues. And the students are, of course, extraordinary. Not only they show interest, but of course they ask the type of questions that you expect that students would, which, of course, puts, I think, many of our experts I think both on their toes, but also I think the experts are delighted in the fact that actually students are interested in their areas of work. At the same time, in the afternoons, for the Global Health Fellows, who are selected to this very competitive program, which is part of our program on global policy and governance at the Sanford School, we also have an opportunity to take them to 10 site visits around the city of Geneva, where they visit everything from the Access to Medicines campaign of Doctors Without Borders to product development partnerships, as well as public-private partnerships like the Global Alliance for Vaccines and Immunizations and the Global Fund, to also visit the shock room where, in fact, they monitor pandemics from the WHO in a room that's set up precisely actually for the purpose of tracking these pandemics as they emerge throughout the world. So it's a remarkable opportunity for our students. We hope to be able to continue to make this type of resource available to them over time. It has grown over the years, and so this past year we had 17 students selected for the program, and this has been, of course, quite an undertaking because we have to place every one of them in a policy internship opportunity that's rewarding. But the remarkable news is that because of the track record of the program, we oftentimes have more sites that are interested in our students than we have students available for the sites. So we hope to be able to continue to make this type of opportunity available. And every year, we unfortunately have to turn away students because we just can't accommodate on our resource limits all the interest and the talent. So it is a very competitive program to get into. But we have had the opportunity to have some extraordinary students that we hope have had some transformative experiences that we hope that will help them in their career path as they hope become tomorrow's global health leaders.